Hi, my name is Dr. Muhammad Ali, and I'm here with Pain Free Lives. Today, I wanted to discuss a topic that's a little bit more personal in terms of my own experience with my own pain. So, about 10 years ago, I had a situation that came up while I was in training. I didn't know why I was having some vague pain on the outside of my thigh. Just thought it was maybe a little bit of some soreness from exercising, etc. I was doing a lot of like high intensity interval training, burpees, a lot of other stuff, and just wasn't sure what it was from. It was just a small nagging pain. So I was able to go to work, do all my training and exercising, and I thought everything was okay. What ended up happening is I started not feeling so well one day, and I was taking some medications, just over-the-counter stuff, just some Advil, trying to see if the pain would get better, and it did. Seemed to resolve it. Would take it once every couple of days, couple hundred milligrams, 400, 600 milligrams of Advil, a normal dose that people would take. And then basically I ended up in a situation one day where I wasn't feeling so well, and I went to the hospital and realized that I was having massive bleeding, okay? So one of the things that I found out through this experience, one of the reasons that I'm so passionate about trying to make sure patients are on the right medications and have the right diagnosis and treatments, is because bad things can happen to you when you're not paying attention. So even a healthy individual that's having a small problem can unfortunately have a mishap and potentially could die because of a very silly thing. Okay, this could have happened to me, and I'm obviously fairly well informed on all these topics. But again, I wasn't doing what I'm doing now, and I'm obviously at this point a consultant regarding this, and I understand why other doctors might miss these things. So this is something that I'm very passionate about, just to make sure that patients understand that little things like just not paying attention to a small nagging pain in your side or your leg or your foot or your back or whatever, they can have long-lasting consequences, especially if you don't seek medical care and get advice and try to figure out what's wrong. So when I was in the hospital, I got a bunch of blood and literally was almost dead. To be honest, it was a bad situation. So, again, patients that come to my office, if they've been on medications for a long period of time, I always ask them, why were you on Advil for 6 months? And I start to check their stomach. I ask them if they've had certain symptoms, you ask them some questions just to make sure they don't end up in that same situation, because it can happen and it's unfortunate. But you need to understand that having a proper diagnostic workup by a professional who knows what they're doing is important, so that you don't end up having something really bad happen from a small problem. Okay? So I think what I should have done at the time was stop, listen to my body, go to a doctor, go to a specialist, try to figure out what's wrong, get some imaging, MRIs, x-rays, some blood work, figure out what I'm doing wrong, and try to get treatment. So if I had been more responsible about that in my own time, I think it would have ended up being a better situation. Thank God. I'm young, I was fairly healthy, and I was able to make my way out of it. But that may not be the case for everyone. And Advil and over-the-counter medications like non-steroidal anti-inflammatories, NSAIDs, are a very, very common cause of death in the United States. This is very, under-recognized, and because you can buy these medications over-the-counter yourself and not prescribed by doctors. So this is definitely something I would say you have to be careful of. But if you have a problem, seek medical advice. Seek a specialist. Go and get help. Listen to your body, especially if you're, obviously young or old, but, try to make sure you get some help, because bad things can happen, especially if you're trying to take care of yourself and you ignore any kind of symptoms that you may be having. That's definitely my story, my personal side of pain management and having pain. Always try to seek advice, listen to your body, and don't just take medications because you bought them from a drugstore and think that they're safe and there's no harm, because things you buy in the drugstore can unfortunately kill you. They can help you, but they might kill you. All right? So just do your best to try to seek medical care and listen to your body, and I think everything will be good. That's what I did, and thank God, it worked out for me. All right, guys. So just a little story on my side. Hope it helps. Again, like, follow, comment, subscribe. If you guys have any similar experiences, I would love to know. All righty. Thanks, guys. Take it easy.